I actually started having jaw issues. My jaw was popping a lot. I went to a dentist and he had x-rays on file from 2021. So he took a new x-ray, a panorama, compared them, and there was a notable change. So there's like joint spaces that weren't there before in my jaw. And he actually showed me like a side-by-side profile of my face, and he noted a definite structural change in my jaw.
Okay, what is going on, guys? This is Mark Millick here with the Moral Medicine YouTube channel. So today we are going to be featuring Jade. Jade is actually going to be our first female patient. I think that's important to highlight because PFS affects not just men, but women as well. Also want to specify that Jade took something called Spirolactone, which is an anti-androgen often prescribed to women for hair loss. So Jade, thank you so much for joining us.
Thanks for having me.
Absolutely. So Jade, I guess, we'll just jump into your story here. If you don't mind, can you kind of give us some context on who you are and your background and, what life was like before you got this illness?
Sure. I'm a teacher. I've been teaching for 8 years. And before taking this medicine, I really enjoyed my job. I loved going to work every day. I was very social. I loved to travel, meet new people. I had lots of hobbies. I was into woodworking. I just loved learning new things. And I looked forward to my future in general.
Yeah, absolutely. And I hear a lot of young professionals who talk about that. So if you don't mind me asking, how did you get prescribed the medication? I think you mentioned you were experiencing just a little bit of hair loss. A lot of people do typically in their late 20s, maybe early 30s. You wanted to, I'm assuming, be proactive. So you went to a doctor. Do you mind just talking a little bit about that?
Sure. In August 2022, I went to a dermatologist because I was experiencing hair loss, and he prescribed me spironolactone.
So how long did you take that for? And did you notice symptoms right when you started taking it, or how did that work?
So I took it for 5 months at 50 milligrams, and I didn't really notice any symptoms at that point. It wasn't really improving my hair loss, so my dermatologist bumped me up to 150 milligrams. So I went up 3 times the amount. And within about 2 months, I started noticing my menstrual cycle was very erratic. So that was the first symptom, but I didn't really attribute it to spironolactone yet. And about a month after that, I started experiencing sexual dysfunction, among other things. Around the 4 or 5 month mark of my new dose, I had complete genital numbness. So I stopped the medicine cold turkey because at that point I was researching and reading about other people on forums and things who had the same issues as me. So then I saw that it pointed to spironolactone. It was pretty devastating.
Yeah, absolutely. Did your doctor give you any type of warning that this medication could cause these types of symptoms, or were you giving any foresight or anything?
No, when I asked him about the side effects, he just told me this is a diuretic, so you might urinate more frequently and you might have dry mouth. Um, I wasn't even aware that it played a role with my hormones,
Sure.
which is something I think he should have disclosed.
Oh, absolutely.
Yeah,
Yeah, it's kind of the same thing with finasteride. It's handed out so easily to people, especially with these telehealth companies, but they don't really tell you what the potential side effects can be other than just like sexual side effects, right? They're not really given the whole array of what could potentially happen to you because doctors don't acknowledge that. So you took the medication, you took it for a few months at this, I think you said 50 milligrams. You weren't seeing results. You went back to your doctor. I guess he prescribed you 3 times the amount of what you were currently taking, right? Really upped your
right.
dosage at that point. And at the 3 month mark from there, you started to experience side effects. Did those side effects, when you came off the medication, did they persist? Did they get worse? Did they improve at all? Or did you develop any new side effects?
They persisted and I developed new side effects. It seemed so immediate too. Um, the most bizarre was the body changes. So I had body fat redistribution. the fat from my lower body kind of moved to my upper body. I started storing fat in new places, like my arms, my midsection, my shoulders and my back got wider. My lower half was kind of just left flat, and I had loose skin everywhere. And this probably took a week or two, and it was just the most bizarre, devastating thing that's ever happened to me. Um, Rapid muscle loss. My weight didn't change, but I had a completely different body, and clothes weren't fitting me right. It was just devastating. Um, and then I developed varicose veins, throbbing varicose veins on my legs, um, skin thinning. So this all happened kind of over the past few months. I've been off of the medicine now for 8 months, and these things have kind of developed over time. Um, Very creaky bones. I actually started having jaw issues. My jaw was popping a lot. I went to a dentist and he had x-rays on file from 2021. So he took a new x-ray, a panorama, compared them, and there was a notable change. So there's like joint spaces that weren't there before in my jaw. And he actually showed me like a side-by-side profile of my face, and he noted a definite structural change in my jaw. So,
I mean, bone loss or anything? I mean, that's incredible to hear that you have that kind of documentation.
well, he actually referred me to a TMJ specialist. He couldn't see the type of x-ray he used, how much bone loss, but he said it was significant enough that he made a referral and he could see the joint damage.
He had to have been shocked by that. I mean, that's obviously not very typical. I'm just curious, what was his response to that?
He was shocked, and I told him about the drug, and he was actually really interested in it. He was taking notes, and he even asked if he could be part of the team. He's like, "Well, can you follow up with me and let me know?" Because I had other doctor appointments and specialists that I was seeing, and he said, "Yeah, I would love to be in the loop with all this." So he was intrigued. Not all doctors took interest. A lot of doctors kind of gaslit me. Um, but I wasn't shocked by the news just because at that point nothing was shocking anymore because so
Right.
much had happened to my body that
Right.
nothing shocked me.
Yeah, it's incredible. I mean, there's so many things you noted there that just it parallels so much with people who take finasteride and develop post-finasteride syndrome. You mentioned like the loose skin, which I developed very quickly, the muscle loss, the facial changes. You said in a matter of, I think, a week or two, you started to notice all this, right? I mean, that's incredibly abrupt, right?
Yes.
And it's traumatic too. I don't think people talk about that enough. I mean, to all of a sudden over the course of a week, look at yourself in the mirror and watch yourself change. I mean, that's horrifying. And I think I want to highlight that because there's a lot of trauma that goes along with the symptoms as well, right? Um, so you went to multiple different doctors, I think you were telling me, and were you dismissed by all of them? Did any acknowledge this or did they believe you?
Um, so I went to a lot of doctors and more notably Northwestern. I went out of state to Mayo Clinic, to Cleveland Clinic, and saw lots of specialists. Some dismissed me. So the endocrinologist who I was hoping I would find the most information from, because this is a hormone issue, I think she was the most dismissive. And she said, no, I haven't seen this. And she basically sent me on my way. Um, but the sexual health doctors or the women's health doctors from all of those establishments, I think they were the most responsive. They said it made sense that what I was on would cause these changes, but they just didn't know how to help me. One doctor gave me a cream to help with the numbness, but it didn't really help. One of the doctors said that essentially I was put into menopause because my androgens were tanked just as a woman's androgens become when they're in menopause.
Sure. Right.
So she gave me a little insight on that, but as far as a plan going forward, there wasn't much.
So I'm assuming you probably did some blood work too, some diagnostic tests. Did anything, were there any anomalies with that or anything that was
No.
well, okay.
I did have low DHEA,
Yeah.
but my testosterone and estrogen levels were within range.
Mhm.
So it was frustrating. I mean, I don't want to get negative results back, but it would be nice to have some type of answer.
In this case, you kind of do, and I know what that feels like, because you want to feel like there's some type of biomarker or something you can point to attribute to these symptoms. And it's more horrifying because my experience was that when I went to doctors, some would kind of believe me until they would do tests on me, and I'd get the results back, like the blood work, and they'd be like, "Well, you're completely fine. Your testosterone levels are good, your DHT levels are good, everything, right?" And they would just say, "You're fine," and they would send me on my way, even though doctors would even acknowledge some of the changes with my body. Because you said you went to Cleveland Clinic, you went out of state, you went to basically some of the best doctors that the U.S. has to offer, and they gave you no answers, which is horrifying. So
Yeah.
that's horrible. I really am so sorry you're going through that. It's so common for patients like us to have that experience. So how has this ultimately affected your life? I mean, I'm assuming it's affected your social life. You mentioned that, work, career. I'm assuming family ties. Does your family help support you, or how does?
Yeah. Yeah, it's impacted every aspect of my life. Um, I developed severe depression and anxiety. I started having panic attacks, and some days I just can't function. It's really difficult to go to work. Um, and my social life, I was once very social, and now the idea of going out with friends just gives me so much anxiety that I avoid it altogether. Um, it's impacted my relationship with my boyfriend. I have had a lot of support though from him, and my mom actually flew out and she's here staying with me now just to help me with day-to-day survival.
Yeah, yeah, I get.
Um, so yeah, and they've been supportive, but it's really impacted my life. I just don't know who I am anymore. And the mental state is something I've never experienced. I've never experienced anything on this level before. And I've seen therapists who kind of try to push medication. And I think, if you just get a little bit of hope, you don't have to be on this forever, but we just need to give you a boost. And I'm obviously extremely hesitant to be put on anything.
Yeah,
And so I'm trying things naturally and
right.
to no avail.
Yeah, I think it's really concerning because doctors want to continue pushing more medication on you when you have this. I'm assuming they try to push SSRIs in particular on you.
Mhm.
A lot of doctors try to prescribe that. In a lot of cases, people I've spoken to, it makes them worse. A lot of people think that PFS, and I'm not sure if you're familiar with PSSD, post SSRI
Yes.
function. A lot of the symptoms overlap, so a lot of people think that the underlying mechanism might be sort of the same. So that might only exacerbate the symptoms. I'm obviously not a doctor. I don't know how that would affect you. I would just say, approach with caution if you decide to try things like that.
Yeah.
Have you tried, you said you tried natural remedies. Have you tried, dieting, working out? I mean, just lifestyle changes. And if you have
Yeah.
any,
I'm on a strict, it's called a low FODMAP diet, kind of trying to clear my gut. Um, I've been doing cold plunging, which is good temporary relief, kind of just elevates those endorphins. Um, I started meditating. So those are things I've never done before, and they're they provide temporary relief, but overall, just once I get going with my day, I can't escape it. And, I just feel like I'm trapped in a stranger's body and it's just
yeah, yeah, it's
miserable.
yeah, you feel like a completely different person, obviously. I mean, completely changing your personality. I mean, I feel like I don't have a personality anymore. Everything is just very, very dull and just mundane at this point. You may have already answered this. Have you experienced anhedonia at all, or cognitive dysfunction, or anything like that?
So anhedonia is in loss of just pleasure in general and
Yeah,
joy.
yeah, exactly.
Yeah. Yeah,
Yeah,
I cannot experience it. I know I had things that I used to enjoy. I try to push those things on me and I can't, it just does nothing. Um, yeah, it's scary. Another natural remedy, I'm trying to work out and I've been religiously working out. But there's been zero gains. I used to have a regimen and I knew what to expect when I would do certain things, and my body just isn't responding the way that it used to. So 0 muscle gains, and I still have all of the loose skin and fat in different places in my body. So it's very frustrating. Um, and as far as the depression and anxiety have become so severe that I'll be in situations, whether I'm in public, grocery shopping, or even at work, where I start to uncontrollably cry. The thoughts are just intrusive, just thinking that I'm not going to get better and I can't turn it off. And it's gotten to a point where suicidal ideation has become relieving. So it's almost something I think about on the daily.
Yeah, I completely understand. Well, Jay, hey, I really appreciate you telling your story here. Before we hop off, is there anything else you'd like to tell the audience? Any closing statements?
Um, I just hope that we get the word out and that doctors will stop prescribing this the way that they are, and or at least that there's enough public awareness that people can kind of advocate for themselves and not trust doctors to just prescribe these things willy-nilly.
Right. Yeah.
Because I don't wish this upon anyone.
Yeah, and it's amazing too because just like finasteride and dutasteride, spirolactone I've seen is prescribed pretty easily to women through these telehealth companies, and I've actually seen some of these companies sell like combinations of dutasteride, minoxidil, and then spirolactone as well. I think Musley, I don't know if you're familiar with them. I think that's what they're called.
Mhm.
They're one in particular. I think they have something called the hair pill, which contains dutasteride, minoxidil, and I'm pretty sure spirolactone as well. And they'll just prescribe this stuff to anybody. It's insane without any warning whatsoever. Uh, and nobody expects to have these symptoms, and that's how you know it's the medication. Obviously, it's the lowest common denominator. You come off it when your symptoms get worse. I mean, that's not typical for any other medication that people take, obviously. So just know, Jay, you're obviously not alone. This is becoming an epidemic, if you ask me. Again, considering how easily accessible these medications are. So we're continuing to fight hard. Please stay strong. We're going to do everything in our power to get ourselves fixed and to get recognition for this horrible disease. But having said that, Jade, yeah, thank you so much for jumping on, and we'll see everyone next time.